Go to that. Welcome.
Thank you, Brianna, and welcome everybody. Good afternoon to the entire San Antonio Immunization Coalition. Special hello to our leader in the state of Texas, Dr. Mollie Williams. She's the state president for the great state of Texas with NCNW. Hello to special hello to Brother Ron Bright. And hi, Stephanie Collier with NCNW local section. And Brianna, nice to finally meet you. So I'm Synovia Moss, and I currently serve as the National Project Manager for the Good Health Women's Immunization Networks, or what we affectionately call Good Health Wins. It's the largest COVID-19 response in the U.S., partnering national organizations to increase vaccination coverage across different racial and ethnic adult populations currently experiencing disparities. Prior to doing this work, I served as a global strategic advisor for Brain Matters. It's an early learning global network, and the program director at the Child Advancement Network at the Medical College of Wisconsin. But here's what I want you all to know. I love to translate science into relatable programs, policy, and effective messaging that leads to collective impact. So this work that we were able to do, especially with COVID, was near and dear to my heart because it allowed us this opportunity to center the role of CBOs in our community, especially at the population level work. I reside in Wisconsin. I chair the Health Equity Committee for the Wisconsin Immunization Neighborhood. That's our statewide coalition of immunization advocates. And I am also a member of the Milwaukee County Emergency Response Team for COVID-19. So have been working on this coalition work for a while. So today, thank you for, we can go to the next slide. Thank you for this opportunity to present to you all. And what I wanted to do, just give you a very high level overview of Good Health Wins and the work that we do at NCNW, and actually who we are and why they are going to be very important to the work that you all do in San Antonio for your coalition. I want to talk a little bit about how to understand the significance that CBOs bring to the table and why you want to encourage CBO leaders to join your coalition to help promote vaccine uptake and address vaccine hesitancy. Explore some of the strengths and the resources that CBOs bring in the vaccine coalition, and such as their ability to leverage trust, cultural competence, and local knowledge. Show you a couple of examples of successful coalitions. I know you guys have seen and heard about vaccines, veggies, and votes, and all the wonderful work that Ron and the NCNW group on the ground there in San Antonio have been able to implement over the last couple of years, but also to examine some strategies for effective communication and collaboration, because this is what we always say, NCNW, Good Health Wins, we're your ground game. We are hundreds of thousands, if not millions of people that you have access to. So next slide. So a little bit about NCNW. We are an organization of organizations. So we were founded by Dr. Mary McLeod Bethune. We are 88 years old this year. We have 300 community-based sections across the country and about 2 million women and men that we impact. And so as we were doing this work with NCNW, our groups and organizations, so we're an umbrella organization for 33 national women's organizations. So we've been doing coalition for so long. Coalition is our DNA. And one of the things that we have always done is look at women's health and understand the role that women play in centering and being able to be those medical decision makers in the home. Next slide. So at the onset of COVID, we were approached by the CDC to help with the COVID response. And we took our network of NCNW with our 2 million, and we are state-based. We are also city-based. So we can slice and dice our demographics down to zip codes. But we were also had the opportunity that as we began to pull our network together with the COVID response, the CDC came back to us and asked us if we would work with the Divine Nine organizations. So those are your 9 largest Black Greek organizations in the country. So with NCNW's network and the Divine Nine organizations, Good Health Wins, we reach 4.5 million people within our reach. So, and we are, these are groups and organizations who are so low to the ground. They're already doing work. Some of our organizations are over 100 years old, so we don't have to look for trust. People come to us because they believe that we've always been there and we will be there before and after. One of the things that's been very exciting for us to see that as we've been centering this advocacy work at the different levels is that we really want to be able to understand what our role is in helping communities of color to understand the importance of immunizations across the lifespan. So it started off with the COVID response, but we very much are looking at all of the different types of immunizations, as well as helping to connect with how immunizations interface with different disease states. So what does diabetes and immunization have, or hypertension, or heart disease? So we know that as we look at these comorbidities, we understand that we have a very special role in helping to message and massage this kind of work on the ground. Next slide. And so we've been very busy. We have a large group. What you're seeing, this is a group of our national project managers and our leadership teams. So in our COVID response with Good Health Wins, we have 40 national project managers, and each of the 40 has a team of 5. So they have a comms person, they have a data person, they have a finance person, and their project manager. And this was a summit that we just hosted in December of last year. It was a national CBO summit on vaccine access and equity. And so we understand we really want to help convene the CBO space so that there is always a ground game. If you think about how many community-based organizations reside just in the San Antonio market, that is a wonderful group for you all to access to help build out your immunization coalition. Next slide. The next couple of slides are just some pictures from the summit. What made this summit very different, it was not a sit and get summit. This was a summit that they had working tables, they had pre-work, they had pre-reads, and we were really looking at vaccine access, equity, infrastructure, funding, and education and training. So we're very excited that we're getting ready to issue a playbook for community-based organizations to continue this work. Next slide. And so as we continue to do, And so what we say to our groups and organizations, Good Health Wins has been amazing numbers, but what we've told our groups and organizations that we want you to talk about immunizations and the COVID response where everyone stay, play, pay, and pray. We want to touch multiple layers of a person's life. And so in our work with the CDC, we partnered with Vaccinate Your Family, who are subject matter experts in the grant, but also with Trust for America's Health. And our folks are everywhere. We had 2,000 mini grants were awarded last year, 6,000 partners across the country. So everything you can think of, they were everywhere. Churches, housing departments, working with different trade organizations, working with industry, schools, childcare centers, you name it. Our goal is where they stay, play, pay, and pray, which is we want to touch all facets of a person's life. Next slide. And so as we're doing this work, I just wanted to just give a shout out to the great state of Texas for all of the work that you're doing. We have this tagline that Dr. Mollie gave us. It's like, we're better together. And that's what we say. If you think about what an immunization coalition is, it's showing the power of us coming together. And so you want to be able to do that, not just across the health arena, but across sectors. That's one of the things we really want to make sure that you all are doing as you're building out your coalition. So next slide. Next, just wanted to show you some of the great work that they're doing in the state of Texas. They had health fairs. They partnered with different groups, whether it be Black or Latina. Next slide. They have been doing, Dr. Mollie, I know you're proud that I pulled those slides out. Okay. So they've done community vaccinations drive. They were vaccinating. We did public-private partnerships, health fairs, all kinds of events all across the state of Texas. Next slide. So as you can see, what we did at NCNW, and that we have this national staff, and we work with our groups to understand how to read data, how to look at what's going on in your community, and how to We translate some technical things so that the average person can understand their role and responsibility as trusted messengers. So we took the CDC's paved ecological model, looked at, across all the different domains. Next slide. But we translated it so that the average person can understand, where do you fit in this maze? How can you get engaged in the work? So first, we want to make sure that they themselves get vaccinated, and then that the people that they have relationships with, their family, their friends, their colleagues, making sure that they're able to communicate and message to them about the importance of vaccines across the lifespan, but also working within their organizations, because now you get large groups of people that can help you with your ground game. I know that, Gwendolyn, when you guys start talking about policy, our folks are already doing, we have state days that many of them have at the state level, on the Hill. So they're already organized as advocacy groups doing things. They've just never been asked to talk about or take the immunization message to the ground. So that's why this work is very important. So now that we have gotten everybody to understand, we have a shared vision of the importance of getting this country vaccinated. It was imperative during COVID, and we saw that it was those CBO organizations. It was the ground game that helped get this country to herd immunity. Next slide. And so we wanted to be able to talk about what are some of the successes that we've seen. We have 4 pillars in Good Health Wins. We activate, educate, motivate, and celebrate. So we were able to activate our 40 state national organizations. We had over 2,000 participating mini grants, 6,000 partners, but you all, hundreds of thousands of zip codes that we happen to reach. We educate. We created a trusted messenger certificate program because we wanted our trusted messengers to have a base amount of knowledge when it comes to the immunization space. We motivate. We do something very special. We have what we call our community of practice. We started them at the beginning of COVID. As of last year, we had over 55,000 people to attend. We just did Community of Practice 70 last night, 1,400 people, 1,397 registered, 1,200 attended the call last night. And so when you keep, as we were saying, at the beginning of this, people say there's a lot of vaccine hesitancy. Well, sometimes we have to say we beg to differ, because what our folks are saying is that we've never been asked to do this work. These groups and organizations, they've been doing all of this health-related work. It just was never anything targeted toward immunizations. And what Good Health Wins has been able to do is to pull all of these organizations together, or let me say this, what COVID allowed us to do, it had everybody working on one thing at one time. And then we were able to see the synergy and the power of the network. And then we celebrate the work that everyone is doing. We have Best of Show. We bring in our speakers. And it really is about real people, real time, in real ways. But we are seeing some astronomical numbers on the ground as far as the group work that everyone wants to do. And then just wanted to share with you all a couple of things that we're going to be doing in 2024. Next slide, please. We are, and what we do, so we have all of these groups and organizations, and so we serve as the convening hub to provide this information. And so we give them a master calendar for the year, and it has here's the topic that we're going to cover this month, here's the task that we're going to do, always a call to action, always trying to get boots on the ground so that we have a ready response. But we are able to really convene the synergy of the group together now. So in January, we are launching with the CDC, the Bridge Access Program, making sure that uninsured and underinsured know where to go get vaccines so that they can stay vaccinated. In April, we're going to publish our playbook around the CBO Summit, but we're also going to celebrate Adolescent Immunization Week with Unity. And we're going to focus on HPV and teens and really making sure that, again, starting to do that lifespan work in addition to the work that we do with the Bridge Access Program. In October, we're going to partner with NFID. So when they kick off flu season officially, we are also going to look at 10 additional African-American markets, and we are going to have many press conferences so that we can amplify the importance of getting those flu and anything in respiratory season. So whether it's flu, COVID flu, and RSV, we'll take a look at all of that. And then in November, we are, thanks to the leadership coming out of San Antonio, we know that it's important to really tie in and do some type of national vaccine and voting campaign. So what we do in our best practices is that you don't have to reinvent the wheel. If you see something that's doing really well, amplify and replicate that work. And so that's why we're very excited. So Ron, I'm sure you'll be very excited to know that we're going to have a national campaign around vaccine and voting. And we're going to do it with the National Panhellenic Council, which means they already have large groups of people ready to amplify this work. And so what will it look like? It will making sure that the poll workers are vaccinated and safe, making sure that the canvassers are safe, making sure that the homes that they visit. So we're going to marry a time when we know that lots of folks are talking to lots of folks. That's what we're going to do with that campaign. And then we're so excited to announce that we're going to have a National CBO Summit Part 2. And this is going to be convening groups and organizations, so not just NCNW, but groups like UNIDOS, groups like the National Black Council of Churches. So we're already talking to our partners at the Urban League because we've all been in this grant together. So just want to that's our high level, quick view of Good Health Wins. It's my pleasure to introduce to you all Dr. Mollie Williams. Oh, that's a certificate we gave everybody. If you're going to do something with your coalition, give people a certificate. They love certificates. Okay, next slide. We did our certificate program. We tested it for 5 weeks. 900 people went through the certificate program, and they went through all 5 modules. Unbelievable numbers. So we really are excited. Ask you all to join us. I'm looking forward to coming down to San Antonio for the Texas Unity Conference. That's our NCNW national team. So we're doing all of this work with 4 people at our headquarters. So thank you. We just stay busy. So it's my pleasure to introduce Dr. Mollie Williams. She's your connection in the state of Texas for NCNW. Dr. Williams. And thank you, Brianna, for this opportunity, Ron, and everybody.
Thank you, Ms. Moss. That was absolutely wonderful. So glad to get the advice about connecting different sectors and not reinventing the wheel. Vote and vaccinate. It's an amazing shared vision that you all have. So thank you so much for enlightening us and both of you being here today.
Dr. Mollie was going to share information about the upcoming Texas Unity.
Yes, please. Please, yes.
Is she on?
Dr. Williams, I think you might be muted.
Well, I guess I will pinch hit for her then until she comes on. So Dr. Mollie represents the sections in Texas. So we have community-based sections as well as, are you there, Dr. Mollie?
Yes, I am. Can you hear me?
I was ready to pinch it for you.
Well, I tell you, you're the one. Good afternoon, everyone. Thank you so much for having me. To our very stupendous leader, I like to say she is the face of Good Health Wins. Mrs. Synovia Moss, to Mr. Bright, to you, Brianna, to Stephanie Collier, who is a part of one of the NCNW sections here in San Antonio, and to all of you, good afternoon. I, as was said, is Dr. Mollie Williams, and I am the National Council of Negro Women's Texas State President and the NCNW Good Health Wins Project Manager for Texas. And I am Texas proud of the work that has been done across the nation. But in Texas, we are shining. We are shining. Veggies, vaccines, votes, and you saw just a smidgen of the work that we are doing here in Texas. And so I'm very proud. Thank you for inviting me. And I thank you for the outstanding work that you are doing in San Antonio. as I peruse your vision, a community where there's nothing on the other side of all residents are protected from vaccine preventable diseases. That's powerful, and that is excellent. The National Council of Negro Women Incorporated is a coalition of 200 community-based sections in 32 states and 38 national affiliate organizations. The sororities, fraternities, civic and social groups are all a part of it. And that is why we say an organization of organizations. Our work is to enlighten and inspire the more than 2 million plus women and men. Our mission is to lead, develop, and advocate for women of African descent. Our history is a glorious one, and I won't go into that today, but at your leisure, if you will peruse our website, NCNW, you will find that it is a glorious history, one that was founded in 1935 by Dr. Mary Jane McLeod Bethune, the child of slave parents, distinguished educator, and government consultant. And so I would ask you in your time, if you would please peruse our section. I am excited that the 11th Texas State Unity Conference and Bethune Heights Recognition Program will be held in San Antonio, Texas, the illustrious Alamo City, and that the San Antonio Ruth Jones McClendon section, and of course with our affiliates, Mr. Ron Bright and the other affiliates, we are looking forward to coming to the illustrious Alamo City with great anticipation. The Unity Conference will be held at the Menger Hotel. The theme for the workshop and the Unity Conference is we are working together to improve the lives of women of African descendants, their families and communities. Their families are going to be empowered, educated, health equity, and social justice. And so we have an array of excellent speakers. Our keynote speaker is Dr. A. Lois Keith, NCNW 9th Board Chair, will give the keynote address on Saturday morning. We have Ms. Janice L. Mathis, Esquire, NCNW General Counsel, who will be the Sisters Fellowship Luncheon speaker on Friday. And then, of course, the opening plenary workshop will be Mrs. Synovia Moss. You just heard a snippet of what she will be doing in the workshop. She is, and you, as you have so rightfully said, our national project chair, but she is dynamic, she is engaging, she is empowering, and she is certainly knowledgeable and has this great charismatic personality that draws all of us in on the first and Thursday evenings. And so we thank her. On Friday night, we will be having, you would not come to Texas without a Texas barbecue, right? And so we will be having a fun night, entertainment. Ms. Collier is a part of that planning committee. Diamonds and Denims, where we will have a Western hat and entertainment on that evening. I like to say, and now we're saying, we are better together when we come together in unity on one accord. And so the 11th Texas State Unity Conference promises to be a transformative experience, bringing together passionate leaders, advocates, and supporters. Our sessions will be enlightening, engaging. We will have workshops and meaningful discussions in order to continue to be the catalyst for positive change in our community and in our world. And so we look forward to the Unity Conference. We are preparing a bus to come from Dallas and Texarkana and Tyler to come to the great Alamo City. Thank you so much.
Thank you so much, Dr. Williams. Let me know again, it's April, the specific dates, it's April.
It's March 21st through the 23rd. And I passed the information on to Mr. Bright. And after the call today, he has indicated he will be forwarding to you our call to conference, which has all the information in it. And of course, the announcements of our various speakers and what the conference will entail.
Wonderful. Awesome. Well, I'll definitely send that out with the meeting notes. And again, thank you so much, Dr. Williams and Ms. Moss, for attending and just sharing the amazing work that both of your organizations are doing.
I would like to also mention that we will be honoring 5 women from the San Antonio area, and that Regina Monroe serves as the president of the San Antonio Ruth Jones McClendon section, and our own Miss Stephanie Collier is actively involved. And of course, Mr. Bright is engaging and motivational. So we're delighted to be here, and I thank you again for the work that you are doing.
Thank you so much. That is wonderful.